AMH is anti-Müllerian hormone, and this is the foremost test to evaluate the female fertility. Now, how AMH is related with the female fertility and what is its significance and why it is done so frequently for all the couples to plan any treatment for infertility. So AMH is a hormone which is produced by the small follicles which are there in the ovaries, and these follicles later they form egg. Now, as we know, the number of eggs for any individual is defined since birth, and as the age advances, the number of eggs also starts reducing. So is the AMH. So as the age advances, the AMH also starts reducing. Now, this AMH on an average, which varies from 2 to 4, or in some cases it may be above 4 also, which indicates the polycystic ovaries. In cases where it is below 2 and when it comes down to below 1, those patients they come under poor ovarian reserve or the low ovarian reserve. So that is the significance of AMH. AMH tells us what is the ovarian reserve of that particular patient. And this AMH can be tested on any day of the menstrual cycle. Like other hormones, the FSH and LH, which can be tested only on the day 2 or day 3 of the cycle, this hormone we can do the test on any day of the menstrual cycle. The second thing is when the AMH is more than 4, it tells us that patient falls into the category of polycystic ovarian ovaries. There the reserve is good, and when the AMH is below 2, especially when it goes down below 1, so there we have to it indicates that the ovarian reserve is going down. So the important is when the ovarian reserve starts going down, it doesn't indicate that patient will not be able to conceive at all, even naturally also, or it doesn't indicate the quality of egg. But when the ovarian reserve starts going down, we have to be more cautious, like how much time we have to give to try naturally and when to advance for the further treatment which helps in conception. So then, based on your other test reports like semen analysis and the tubal factor and the age, your doctor will tell you how to proceed for the treatment when your AMH is going down. So there is nothing to worry about. Don't come into that panic mode that my AMH has now reduced to less than 1, so what should I do? You always see your fertility specialist. As I told you, it doesn't indicate the quality of the egg. Okay. So another thing is there are various protocols which we follow when the AMH is low. There are other adjuvants, I would say, which also helps in those patients to have the good oocyte recovery for the IVF patients. So this is one aspect of AMH. Now AMH in certain cases it starts reducing where there is a history of endometriosis or there is history of any pelvic inflammatory disease or sign of infections, or it can be because of autoimmune thing also. Autoimmune means the immunity is developing against your own ovary, which is reducing the AMH. In certain cases, you cannot say what can be the reason why the AMH is going down. So the important is to go ahead and follow what your doctor advises to you when the AMH is started going down to less than 1. Then again, it also depends on the age of the patient. If the age is advanced plus your AMH is low, the probability of getting pregnant it reduces because it affects the genetic changes as the age advances. Versus other group of the patient where the patient is young but the AMH is low. There, the genetic changes may not be that deteriorating. So the chances of having the good quality eggs may be much better and the prognosis is much higher than as compared to the advanced age group patient.